So I'm curious, you brought up the nuances between provider being hospital versus provider being physician group. How do those contrast, especially where you do have the insurers on the other side of the table?
One really, really clear demonstration of that is played out by the Disperse Act, which a lot of things in the recent environment are. But you look at differences in inherent negotiating power between those three actors, right? Insurers, clinical providers, clinicians themselves, and facilities, especially in a post-NSA world, that negotiating power is drastically changed. Let's say an employer group, right? If you're an insurer who's a third-party administrator for a large employer, it matters a lot to you in order to sell your product that you've got your local hospitals in network, right? What employer wants to offer an insurance plan that doesn't have the biggest hospital down the street? That gives the hospital some negotiating leverage and power to get to a fair and reasonable in-network rate. Post-NSA, for the ED doc, that leverage isn't there, right? It doesn't particularly matter in most instances for an insurer, group or non, whether the ED doc is in network. As long as the facility is, they've got to provide that care, obviously. The opportunities for applying any sort of pressure on reimbursement are pretty limited to the IDR process. So, I mean, that's one, right? And then that, of course, leads to interesting dynamics between traditionally closer to being allies than in the past, hospitals and providers. Do hospitals start thinking, well, insourcing is a better option here because I've got that leverage and my outsource provider doesn't? It's interesting to see how some of those dynamics are going to evolve as implementation of the NSA does and as get factors work themselves out.
You've given a very professional, objective answer, but do you sometimes say you could bring more mojo, more bravado, more personal, I got to do this right when representing physician groups who are the care providers, folks who spent years and years training to deliver, the most important element of healthcare?
Look, I may be a little biased because I've been, with the organization for 3 years. And to your point, it's the clinicians that are providing care, right? Without that part of the process, there is no healthcare system, right? There is an imbalance of spending ability within the advocacy space between insurers and providers, right? The insurers have a really big lobby that's often hard to compete with. But I tell folks all the time, I would much rather take 10 clinicians around Capitol Hill to meet with legislators than 10 insurance execs, right? Yeah. There's inherent credibility because, again, they are the ones who are actually in the trenches doing things. And there's real risk within the system at the moment.